Turn this back on. So now if we could have the lights up, we've got a question and answer period, and we'd like you to write down any questions that you have and pass them to the person on the aisle in your row on either side, and we're going to have some people walking up and down collecting those if you want to stand up and take a little stretch, but don't leave because we really want to hear your questions. We think this is a very important part of this morning. And we're bringing the chairs up here, yes? Thank you, Jeff. That's great. Someone bringing the chairs up here? So while things are getting set up for the question and answer period, I just want to also mention that after we're done here, we're going to have refreshments out in the lobby area, and this will be a chance to talk with Dr. Kawasaki and his wife, and also any of the speakers from this morning. We're all going to be out there, and we'd be happy to continue the conversation and have some dialogue with you. So we'll get your questions passed up. This is an epidemiology question, so I'll field this one. And the question is there a larger percentage of males who acquire Kawasaki disease? And this comes back to the genetics of KD. Yes, the answer is. More male children than female children get Kawasaki disease, and there must be a genetic basis for that. Obviously, our male and female children have the same exposures, and we hope that through our genetic studies we'll understand that. But yes, there is a male predominance in this disease.
There's a question here that asks for the long-term, are you testing mainly for fibrosis? And I think we have experts talking about that later, so I'm going to defer to them because they're going to give you a better, more thorough answer than I will. So. All right, so this question is, are there any specific dietary restrictions or advice long-term? So, you know, this is the low-fat diet, high exercise that is recommended by the American Heart Association, and this is available to all of you on their website. It's americanheart.org, and this is the Heart Healthy Lifestyle. There's multiple links to it, including recipes and dietary recommendations, and these obviously include low-fat, lots of vegetables, lots of fruits, and a high level of exercise. And again, the purpose of this is to prevent coronary artery disease as an adult that can, sort of on top of the coronary artery problems that have occurred with Kawasaki's disease, worsen.
So one of the questions is, my son didn't receive IVIG treatment until day 13. Are there any higher risk of complications? The answer is, unfortunately, we don't quite know, because the way the initial study was designed was that the reduction of coronary artery abnormalities from 25% to 3 to 5% were done within the first 10 days of illness. What I can say is that gratefully your child was treated appropriately, and that we do this all the time here with children that still have inflammation even after day 10, because we feel that there's definitely a benefit. As a clinician, we can say that we feel that there's a benefit even though it hasn't been studied that way. The other quick question was, there's a very interesting question here about educating the community about a child with KD who was misdiagnosed many times, and that it's very frustrating from the family's experience to have this happen. What can we do to help educate parents, doctors, in our community, flyers at school? So I certainly welcome this. Dr. Burns will be speaking a little bit at the very end of the symposium about what you as parents can do to help us. Community education is a huge issue and a huge outreach that we work on. And if any of you have any resources that you can help us access in your community, whether it's a health fair that we can help you with, whether it's the physicians or We work a lot with my husband's an emergency room doctor, so I can say this. We work a lot with local ERs that misdiagnose our kids with KD to try to educate them. So please let us know where we can be of help. We certainly can work with you. We have a lot of information and resources and flyers that we can hand out, and we're willing to do that. And we can do it both in our Spanish-speaking, English-speaking, and also our Tagalog-speaking communities.
So there's a question about immunizations, and I'm glad someone asked this. We've been getting a lot of calls about H1N1 vaccines. So yes, the vaccine's safe. Yes, your children should get the vaccine. Yes, your children should get all vaccines. The only caveat is, and this is in the handout that you get in the hospital, the live vaccines for the first year after Kawasaki disease, and those would be the traditional live vaccines are the chickenpox vaccine, or varicella, and the MMR, which is the measles, mumps, rubella. Those two live vaccines need to be delayed, not because they're dangerous, but the vaccines won't work well in your child if they are within a year of having received the IVIG. So those two vaccines only. Right now, in some communities, for some people, only the live H1N1 vaccine is available. And even if your child has recently had KD, we don't have detailed information about the antibody titer in that IVIG. So we say all the flu vaccines are fine for your child. And yes, you should get them. And there's no evidence that the immune system is abnormal or has been affected by the disease.
Okay, let's see here. Got a lot of great questions. You guys did really good. Okay, are you seeing KD patients without acute onset of aneurysms presenting years later with heart wall thickening or stiffening? The short answer to that is one of our questions, research questions, that the research group is working on, and I think we will have an answer on that later in the next few years, but I think that the short-term answer is probably going to be that there is going to be some the heart is going to be abnormally stiff, and whether that has any clinical significance whatsoever or not, I think that's sort of in evolution. And that question goes on to ask what is recommended for monitoring and testing of kids who were cleared following the acute phase. And that's a great question. This is something that is in evolution. If you had asked us that question probably 2 or 3 years ago, we would have said, well, maybe you don't need to have any follow-up at all. But I think now we're going to be recommending for all of our KD patients follow-up on an every 3 to 5 year basis with variable testing depending on what your situation was at the time of the disease.
So this is a question for Dr. Kawasaki. Where in Japan was the first case recognized?
1961, I experienced the first case in Tokyo, and who is a 4 years, 3 months old boy. Now he is more than 50 years old and quite genki.
Now sounds he's very fine. Next question is there any district geographic distribution in Japan?
No. There is no difference between the Japanese areas patient distribution.
Okay. All right, let's see. I mixed them all up now here.
All right, we'll pass it.
Sorry, let me pass it because I did mix them up. Sorry.
All right, so we have our son was diagnosed at 23 months. He was treated on the 10th day after onset of his fever. and you continue to have a high fever 1 week after the IVIG therapy. The question is, what do we do if our son's doctor does not believe he needs late treatment, and we do? This is certainly a question about advocating for your child, this is a very difficult question as a mother myself, and the issue really comes down to having an honest conversation with your physician. I would hope that any physician that you approach and say that you're certainly concerned about the recurrence of fever and that the ongoing inflammation, and that if I'm always open to having families have a discussion, an open discussion about what the best therapy and modality would be. Ultimately, as parents, you hopefully have the ultimate say with your children and can seek medical care elsewhere if you really think that's an issue. But I always tell parents that you are the advocate for your children, and just have an honest conversation with us. What, if any, research is there a correlation between celiac disease and KD? I grabbed a couple of these that I think will be addressed further. There's also a question about KD children that now suffer from arthritis. Dr. Kahn, as well as Dr. Daniels, will be talking about the adult collaborative study, and there's a huge, long questionnaire that goes along with that. If any of you have children over the age of 16, or that will be 16 in the next few years, your children may qualify for this study. And the questionnaire includes this very issue about the long-term, other diseases that are associated with children that have Kawasaki disease. We don't know about there being a direct genetic link whatsoever, but we think that there may be other diseases that happen more frequently in kids with KD, and we'll be looking at that. Have there been cases of recurrence after greater than 36-hour period of no fever, for example, 2 weeks? It sounds like a family had here. A child was treated with IVIG and was fever-free for 2 weeks and then experienced recurrence. He was treated with IVIG again and again had fever for 2 weeks. Then had another occurrence and was treated with infliximab. So certainly we do see this here, and we are always available to you if you're here in the San Diego area, and we're taking care of you. Jane and I are the two that carry the pager, and we're available to you for any questions that come up. The most common cause of fever in our children with KD is not KD. Yeah. The most common cause of fever is not Kawasaki disease, gratefully, so you can come into the hospital and go out with influenza now. But if it is recurrence of Kawasaki disease, then it certainly can be more than 36 hours. It can be a week or two later that you can have this problem. A couple of other ones. One's about sleep problems after having acute Kawasaki disease. So our answer to this is that children, when they come into the hospital at the age at which they have KD, usually in their 6 months to 5 years of age traditionally, this is the age in which children really want to have control over what's going on, and this is the age at which we completely take away their control, so sleep disturbances are not uncommon, as are behavioral changes and acting out at home. It doesn't go away with time, as I've been told, so there is hope for the parents of this 5-month-old.
And it's not specifically related to Kawasaki disease. It's just any disease that requires a child at that age to be hospitalized is going to result in behavior disturbances, sleep disturbances, eating problems. It's just a trauma emotionally to the child, unrelated to Kawasaki disease, but they'll get over it. So a number of questions here. Someone wanted to know if the incidence is actually higher in Asians, and the answer is yes. And that applies to Asian Americans living here. Someone wanted to know about an update for the national database. So the data that I presented to you today are just those data from our patients here in San Diego. And what's evolved over time, at previous symposia where I've spoken and where we've given information to parents, we were really enthusiastic about the idea of trying to create a national database. Now, the insurance companies have essentially done that for us for marketing purposes and for tracking money. They have made databases, large databases, that contain complete information about all of your children. And it's actually possible to get access to those databases. And from that, we can get information. So I think we've switched our tune a little bit now, that we don't feel that the limited resources that are available to bring to bear on Kawasaki disease would be that usefully spent recreating what the insurance companies have already done, and this database we can have access to. So we know quite a bit now, a lot more than we did several years ago, about how many Kawasaki patients there are and where they are. So I would say, let's switch our focus to raising funds for research on Kawasaki disease and switch it away from the focus on the database, which a national database which would be very expensive to implement and in a sense partially already exists. Another question about factors leading to Kawasaki disease, carpet cleaning. And if Mimi Glaudet would stand up here in the front of the audience, Dr. Glaudet and I, Dr. Glaudet started as my mentor and became a best friend. But in 1982, we published a paper. Part of it was excerpted in that important medical journal, the National Enquirer, and as a consequence, became very well known by the lay public. We actually made Service Masters' stock go down. They're a major carpet cleaner, and when that came out in the National Enquirer, their stock went down. I thought that was like a big achievement in my career, but the issue about carpet cleaning, I have to say, is still up for grabs. We certainly do not think that it plays a major role here in San Diego County, where we did a careful epidemiologic study. It's not yet published, but we did do a case control, very good methodology study, and we did not confirm any relationship to carpet cleaning here. However, in Dr. Glaudet's community at the University of Colorado in Denver, very climatically different area, 2 studies have been done, both of which suggested a relationship. So I think it's up for grabs. It is not caused by chemicals. I know there's been a lot from the Travoltas about chemicals in the environment, and that never was a hypothesis, and it is not a hypothesis about what causes Kawasaki disease. So the honest answer is we don't know, and the carpet cleaning thing is probably not, at least certainly not here in San Diego.
Okay, there's a lot of questions that about kind of long-term things, and I know Dr. Daniels and Dr. Kahn are going to talk a little bit about that. So if we don't answer those questions, I think you're going to get to hear about them in the latter half of the session, and then you'll have a chance to ask those questions again, and I'll forward those on to those guys. This question has to do with the side effects from aspirin use. Really, the only big side effect. Maybe I'll just talk. Sorry, so I'm getting a lot of reverberation. The big side effect is bleeding, of course, and that obviously is self-limited. If you get a nosebleed, it might last a little bit longer. If you get a bruise, it might be a little bit bigger. You can't hear me. Okay, I'll try it again here. Hello? Okay, sorry. The question is about the long-term effects of aspirin use long-term. So side effects of aspirin use, they're really, it's very safe medicine that's been used for a long time, and there's good experience with it. There is, of course, there increased risk of bleeding, and the bleeding is usually self-limited. It might mean that your nosebleed takes 15 minutes to stop instead of 5 minutes. It might mean that your bruise is a little bit bigger. There's also a theoretical risk, or at least one that's talked about, with something called Reye's syndrome, which is where you get influenza infection, and if you're on aspirin, there is a potential for getting this. As far as we know, there's no episodes of, and someone can correct me if I'm wrong, there's been no reported Reye's syndrome in patients on low-dose aspirin. Is that correct? Yeah? Okay. There's a question here about reproduction problems in males. Again, I just briefly had one line on one slide about pregnancy in patients that have giant aneurysms and how reproductive counseling is important. I do not know of any reproductive problems in males unless someone else does, okay? But females, of course, should be counseled and receive contraception if they have giant aneurysms. Let's see here. Gosh, you guys had so many good questions. I have about 15 more here. Do kids with aneurysms get sick more often than others? And does it take them longer to get well? Maybe I'll pass that off to one of you guys.
So there's a quick question about immunizations, and if we know if it plays a role in the cause of KD, or even lowering a child's immune system to make them more susceptible. We don't have any data to support that there's any link between immunizations, and Kawasaki disease. And Dr. Burns and I, both as pediatric infectious disease specialists, feel very strongly that all of our children with KD should get all of their immunizations. In particular, I'm going to stress to everyone in this audience about the H1N1 vaccine. And I'd be happy to give you further information about where it's available. I took my own daughter to Oceanside Clinic the other day to have the intranasal H1N1 given to her. So there are specific situations. If you've had IVIG in the last year, as Dr. Burns mentioned, you should get the shot rather than getting the intranasal. And there's age restrictions. But we do encourage everyone to get vaccinated, and with our current climate, to have the H1N1 vaccine. Right, so Dr. Burns spoke with us about this a moment ago also, but when you receive intravenous immunoglobulin, the immunoglobulin has a number of antibodies that are circulating, that are part of it. And so if you give a child a live viral vaccine, traditionally we've thought of measles, mumps, rubella, and the varicella vaccine. If you give a child those live viral vaccines, they don't respond to it. And there's nothing wrong with giving the child the vaccine. You'll just think you immunized him and you really just won't mount an immune response. And there's some data that suggests that there may be circulating antibodies for the H1N1 virus or influenza in the IVIG preparation. So our current recommendation is that children that have received IVIG within the last 11 to 12 months not receive live viral vaccines, but that doesn't mean that you can't get vaccinated for H1N1 because there is an injectable that's available for children 6 months and above.
There are a number of questions here about siblings. So number one, there is a genetic predisposition, but siblings only share 50% of their genetic material. So the chance that you would have one child who has Kawasaki disease and a second child who doesn't have Kawasaki disease and never develops Kawasaki disease is very good. Siblings do not need any special testing. You don't have to have any special concerns that your child could have had secret Kawasaki disease, except in the following situation. And this is new information. It's not published. One of our students working with Dr. Shimizu is actually preparing this now to share with the medical public. And that is that identical twins, and this means monochorionic twins. So sometimes if these are same-sex twins, you actually have to have genetic testing to figure out if they are identical twins. They are identical twins. We'd like to hear from you. We do believe that the identical twin needs to have some testing, and at the very least an echocardiogram to make sure that they did not have occult or secret or silent Kawasaki disease. And this has happened in some families where we went looking and we found problems. So we do urge you to contact us. There's a special research interest of us, and we'd be happy to arrange to get that echo done. But outside of the situation of identical twins, the other twins, other kinds of twins like fraternal twins do not need to have that concern. They're just like siblings except for they got born at the same time. So no special testing for otherwise well siblings.
That means brothers and sisters.
That means brothers and sisters, she adds. Okay, here's a question here about dilation of the aorta, and it asks, what therapy do you anticipate will be available? Is this going to cause a problem in adulthood? I don't know, but I'm really curious to find out. We're doing some research on this. I will say that I haven't seen any patients that have had an aorta that is so dilated that we would be worried about it becoming further dilated or rupturing or creating a aneurysm yet. So right now, anyway, the dilation of the aorta, it is dilated in a small subset of patients, less than 25% of the patients. And what the clinical significance of that will be told as we do more research on that. We're actively doing research on that here. There's a question here about, there's a few questions actually about aspirin. So should we take an aspirin every day? You know, this is a loaded question. There's adult cardiologists in the audience, and they would probably say it should be in the water, I think. I don't know what their answer would be. I do not take one every day. But this question is actually a good one. Our children should take an aspirin every day as they grow up, now that we know that there could be coronary artery problems later, even if their dilation has resolved, why or why not? So that is currently not recommended, although we do know, as we briefly touched on, and I think you might hear a little bit more about later, the coronary arteries are not normal later in life. They may have some fibrosis to them, and I think that's another question in evolution. Aspirin in general is very safe, and I think that we probably will have a pretty low threshold in placing patients on aspirin that are going to have later coronary artery problems. Do you want to add to that? No? Dr. Gordon? No? Okay. Let's see. What are the largest aneurysms I have seen? I'm only 5 years out of fellowship, so I don't know. I've seen maybe 8 or 9 millimeter aneurysms. Jane's probably seen bigger. Big.
They get bigger.
Yeah. Let me pass this.
So, a lot of questions about what causes Kawasaki disease, and again, I just have to say as a blanket answer that we don't know. And a lot of questions about, my child is normal now, but could something bad happen later on? And I think all of those questions are going to be addressed in the next session. The answer today to that question is we don't know. And I just think it's important to stick with that uncertainty. So we believe right now that all children with Kawasaki disease need to be followed up for life until we say that you don't need to be followed up for life. And that information can only come from the kind of studies that we're embarking on here at UCSD. And we will get those answers for you. But for now, they all need to be followed up. There were some questions here about children who had had aneurysms that had resolved. Resolved does not mean normal. Those children need to be followed up. All of them need to be followed up. All of the ones with normal echocardiograms need to be followed up. Everybody needs to be followed up.
There's a question about if a child is misdiagnosed and received no IVIG or measurements of the arteries, is long-term care needed? And this just echoes what Dr. Burns has been saying about follow-up. And certainly, especially for any child that did not receive IVIG and was diagnosed with Kawasaki disease, our recommendation is that there's lifelong follow-up for all children with Kawasaki disease, regardless of therapy. We feel even more strongly about children that never received therapy, just because we need to make sure that we follow them closely if there's no other sequelae that have come up in the meantime.
I think I just have one more. This one asks, what vitamins and supplements do you recommend for kids with aneurysm? Should they be on fish oil? This is a really interesting question. There's a lot of things out there available right now, and a lot of supplements. And unfortunately, there's not a lot of data on whether these things are good or bad for your child. The only thing I will say is there is some evidence of what we say is oxidative stress or free radical formation during the acute phase of the illness. And although there is no proof or data to support this, and so we are not doing this, but some people postulate that antioxidants might be useful, so maybe sitting your kid down with a basket full of blueberries would be good. But as far as the other stuff, I think all those other things, you really have to weigh the risks and the benefits and make sure what you're using is safe.
I think we're going to stop now. A lot of your questions specifically haven't been answered, but maybe they've been answered somewhat generically. And some of them we're just saving because they're really, I think, going to get answered in the next session. So there are refreshments out there. Thank you, everybody. Please go out and meet each other and ask us your questions.